Secretary of Health and Human Services, RFK Jr., pushes back on health insurance pre-approvals and corruption in government oversight.
One which maybe didn't get as much attention as it should, but I think is exceedingly important, is RFK Jr. in his Make America Healthy Again movement has been pushing to try to get insurance companies, and basically has been threatening to make it so that it's an obligatory thing, that these insurance companies not delay or prevent treatment by saying, oh, you didn't ask for pre-approval, so therefore we're not going to pay. Or you ask for the pre-approval and they deny it. And they basically prevent you from getting, oftentimes, life-saving care. And that's a big deal here in the United States with our less than perfect healthcare system. That's something I'd like to cover just briefly and talk a little bit about how this is a big deal for anyone who's ever had a family member themselves in this situation, or God forbid, may one day be in that same scenario.
Let's take a look.
All right, here we go.
Dr. Oz pointed out 85% of Americans say that they have had delays in healthcare because of prior authorization. And the doctors hate it. Doctors report that it costs them 12 to 15 hours a week filling out forms. Some nurses are spending over half their time dealing with the administrative burden of this. And healthcare is often delayed to Americans. The cost of administration is enormous to our healthcare system, and we're going to be able to eliminate a lot of those costs by what we're doing today.
And imagine needing life-saving treatment and
waiting for prior authorization.
No, hold on. Wait, let's call the insurance company and be put on hold and see. And many of these initial denials, ultimately the doctors, and we actually have videos we can include in another episode, where physicians get on the phone with the insurance companies and do something called peer-to-peer, where they speak with another physician and basically have to convince the other physician from the insurance company, whose job is to deny everything, okay, that there's a legitimate need for this. And these doctors are like, this is insane. I shouldn't have to explain myself. We're doing this because it's the right thing to do. Yet this happens every single day nonstop. And to put things in perspective, we have a clip here that kind of shows how important this is. The good news is that in the days following the clip we just played, the CEOs and leaders of the various insurance companies in the United States have actually met with RFK Jr. and basically committed to making dramatic changes. So rather than wait till the government forces these changes upon them, they're trying to craft a way to satisfy the intent of what RFK is trying to do, and yet still maybe not be totally blindsided, because they use this as a mechanism to save huge amounts of money. But here's one clip from Inside Edition, just a simple scenario of how important this is. Here we go.
When you're having a medical emergency and the hospital is too far away, you're taken in a medical helicopter, also known as an air ambulance. But when this woman got the bill, she thought there was a mistake, but there wasn't.
It's a dire medical emergency.
Amanda, please come back to me. You stay strong.
The woman on the stretcher has suffered a life-threatening heart attack.
Jefferson County 911. I need an ambulance immediately. Amanda, come on! She's turning blue!
The closest hospital equipped to save her life is over an hour away in Louisville, Kentucky.
You come back to me!
Her only hope? An air ambulance. A specialized chopper cut the hour-long trip down to a mere 17 minutes. And this is Amanda Boley today.
That was definitely the difference between life and death.
But she says her gratitude turned into quite a shock when she saw what that air ambulance cost. $65,000.
At first, I thought this just has to be a terrible mistake.
Anthem Blue Cross Blue Shield denied coverage for the ride. Why? They said she needed prior approval.
You're unconscious. How was I supposed to get pre-approved?
Amanda appealed the decision not once, but twice, only to be denied again and again. She says it wasn't until a local TV station aired her story,
a battle against their own insurance companies,
that Anthem changed course, covering the full amount. But Amanda's not the only one who says they were put through months or even years of hell fighting with their insurance companies for a life-saving air ambulance ride.
And at the end of the story, of course, I'm sure because the attorneys from Anthem Blue Shield reached out to Inside Edition, they said, in the end, we cover these, and we cover so many of these every year, and it's because they didn't have the right paperwork at the beginning. But as you can really tell from the story, the norm is to be denied. Okay. And certainly if you don't get your case brought up to the local news station and you start getting some noise made, how many people wind up without getting reimbursement for things that literally saved their life? What is your life worth? So that's why this is an important change. And I'm really glad to hear that it appears that this is a change that's going to affect everyone in the country and is going to allow access to healthcare in a very big way.
And like the lady said, it's completely ridiculous to expect somebody who's injured, who's incapacitated, to call up their insurance company and do a prior authorization. Like, it's just stupid, right? So these regulators, these bureaucracies, what they do is they'll create systems and processes that are impossible or super hard to follow. And then they can penalize you and use that against you and not cover your claims and stuff like that. Now, like we discussed separately, helicopters are super expensive for a variety of reasons, and drones will soon be replacing them for a lot of these tasks. But it isn't just about air ambulances; it's about everything, right? Anything that happens to you in the American healthcare system is probably somehow, some way, the insurance company trying to screw you. And even if you do pay for insurance, there's a difference between HMOs and PPOs. And one of the main differences is that one of them, before you can get any test, whether it's a blood test you think you need or an x-ray or something, if you broke your hand, you got to call up and go to your doctor first and have an appointment with your doctor and get a referral from your doctor before you can go ahead and get that done, instead of going and getting the test done and coming to the doctor with the results saying, hey doctor, can you help analyze these results? Even that is like a core difference in the types of healthcare plans you can choose. And it's just stupid versus more stupid, kind of, right?
Yeah, I agree. It's more intricate than that. Even with the PPO, again, the issue, certainly PPOs have a broader availability of options, don't have the constraints of requiring in-network use of providers, but there's things that need to be changed. And I'm glad to see some things changing. And the insurance companies are one piece of a larger puzzle. The other are the drug manufacturers. Let's take a look at this essentially tongue-in-cheek commercial. It's a commercial in and of itself. Let's take a look.
Ask your doctor about how
I'm so tired of these ads.
Whoa, who are you?
I'm Big Pharma.
We spend a lot to get into your living room. Over $18 billion a year. Selling medicine you can't even get without a prescription. All that spending buys off the media and drives up prescription costs for you. And that's why there are only 2 countries that allow us to advertise. Cheers.
Learn more at bustbigpharma.com.
Got any nachos?
So that's an ad for bustbigpharma.com, which is an actual website. And it has information we've covered in part in other episodes where basically we're one of only 2 countries, guess what, that allow drug advertising. And the drug companies and the insurance companies, they meet regularly, let's put it that way. This isn't, you can't really think of all these things as isolated. You have to think of them being together. And then the same thing, we also touched upon the control of government bodies that make decisions, that actually sit and are supposed to be protecting us, making decisions about things like food guidelines, making choices about things like vaccinations. And one of the things that was in the news recently was how RFK Jr. basically got rid of an entire group of people that were making these sort of decisions on vaccines. And they're saying, oh my gosh, he's going to put some anti-vaxxer in charge and this is horrible. But here's a clip. It's a little long, but it shows really why that was absolutely necessary. That the decisions were being made in open, basically saying, oh no, we didn't really test and we're not really sure, but okay, we'll approve it. Let's see how this actually works behind the scenes so people can maybe understand what's really going on. It's pretty scary.
Is there any comment on using this vaccine at the same time with other adjuvanted vaccines?
We have no data to make a recommendation one way or the other.
Just to put this in context of other vaccines, whilst preclinical studies were not done using these vaccines simultaneously, our general approach to immunizations is that they can be given at the same time in different limbs.
Dr. Hunter?
Are multiple adjuvanted vaccines used in Europe or other markets?
Dr. Ward, do you want to comment?
My knowledge.
Okay, I think unless there's any further discussion, we will take a vote on this recommendation.
I want to remind everyone to please check your voting, whatever, machine thing, and I don't know what it is. Voting is open.
Thank you very much. So the voting is completed, and it is unanimous to support this recommendation. Thank you all.
Does anybody have any comments they wish to make about their vote?
Just a slight reservation. I think this is a huge advance and a step forward. I am concerned about that signal, that myocardial infarction signal. I am concerned about the use of this new adjuvant. I certainly urge us to continue to look at the post-marketing data carefully.
Dr. Hunter?
Just a question about that. How soon would we be getting that post-marketing data update here?
There's two kinds of data. The vaccine safety data link data will require people to be using the vaccine to develop substantive database. And Dr. Sun, do you want to comment on the post-marketing data that FDA is requiring?
I think for the myocardial infarction study, we're seeing that the date or likely for completion is May 31, 2020. There will also be studies looking at autoimmune diseases as well as herpes zoster, and there will be a pregnancy registry as well. So that's all included in the post-marketing surveillance.
Thank you.
You saw at the end it said, I thought this was a United Life skit, and of course it wasn't.
It is truly unbelievable. It's like, hey, has this ever been tested for all of these potential issues? Oh no, we never tested it. Hey, has this been tried out in Europe or any other country? No, this hasn't been tried anywhere else in the world. Okay, so should we do this or not? 100% yes, 0% no. But we'll just count on the post trials after people are already addicted, after the companies are making billions of dollars. We'll just count on tests then to make sure that they're not, hopefully, that they're not influenced somehow, some shape now that the companies are making so much money. And as if it'll be so easy to roll back a vaccine that's already been FDA approved, has been given to children. It's just unbelievable. And earlier you mentioned that we are one of 2 countries that allows advertising of drugs. The only other country is New Zealand. And yes, they do technically allow advertising of some drugs. It is extremely limited and regulated there. So it is nothing like what we see anytime you watch any TV here in the United States. It just seems like this entire industry is basically not completely a scam, but huge elements of it. And especially the way they earn money and the way they cozy up and work with the government is just a scam like we saw in that advertisement earlier. What do you think?
Yeah, I totally agree. And again, this is the group that was basically all replaced. This is ACIP. So this is the Advisory Committee on Immunizations.
May everyone keep pushing to make America healthy again. Be sure to watch our other clips and shorts and the entire episode 16 of the Yo Joe Show podcast.